for them. So, hi everyone. My name is Gwen Driscoll. I am the Director of Communications here at the UCLA Center for Health Policy Research. It is my pleasure to welcome you once again to our 2015 Health Policy Seminar Series. Okay, as I always do, I would like to let everyone know about our next seminar before I introduce today's speakers. It will take place on May 21st from noon to 1. Our May speaker is Dr. David Grant, Director of the California Health Interview Survey, who will be discussing an upcoming study that looks at 10-year trends in the health of young children in California. You'll want to tune in to hear whether or not California parents are reading more to their children and more good stuff. So again, that's May 21st at noon. Just so you know, we will be recording today's seminar and it will be placed on our website and on the websites of our two partners, the UC Global Health Institute and the UCLA BLum Center, approximately 1 week after the live event. So please check back. In terms of the center's ongoing health policy seminar series, you can find links to all our past and upcoming seminars on our website or by subscribing to our monthly e-newsletter, Health Policy News, and the link should be up on this slide. Okay, I am now very happy to introduce this month's speakers who are here to talk to us about a new report released today that ranks state policies nationwide that impact the health of undocumented immigrants. If you have already perused the report this morning, you will have seen some surprises, including Texas outranking New York and Florida ranking near the bottom despite its huge immigrant population. Here to talk about the report's findings in order of appearance are Dr. Stephen Wallace, who is the Associate Director of the UCLA Center for Health Policy Research and Chair and Professor in the Department of Community Health Sciences at the UCLA Fielding School of Public Health. Maria-Elena Young will be after Steve. She's a graduate student researcher here at the center and a doctoral student at the UCLA Fielding School of Public Health in Community Health Sciences. And then Dr. Michael Rodriguez, who is the director of the UCLA BLum Center on Poverty and Health in Latin America, the co-director of the UC Global Health Institute Center of Expertise on Migration and Health, and a professor and vice chair at the UCLA Department of Family Medicine. He's also a center faculty associate. All three are co-authors of the joint report that was released today, which was supported by the UC Global Health Institute, and which will also be discussed in even greater detail at a panel presentation this Saturday at the UC Global Health Day Conference at UCLA. And on this slide, there is a link at the bottom to more information about that very interesting and exciting event. As we have a fairly packed lineup today, please reserve all but very pressing urgent questions until the end of the presentation, where I will be moderating both your online and in-person requests. I am now delighted to introduce Dr. Stephen Wallace to start us off.
Thank you, Gwen. Till we get our slides up here. Here we go. So thank you for being here today. We're going to give you an overview of the report that we just completed, Creating Conditions to Support Healthy People, State Policies that Affect the Health of Undocumented Immigrants and Their Families. So we've been talking to a number of media outlets already yesterday and today, and the first question they always ask, so I thought it would be a good question to address today, is, so why'd you do this study anyway? So I think as a background, as those of you probably know who are here, the Center for Health Policy Research focuses, as does the BLum Center, on policies that impact the health of populations. And there's been a lot of attention recently to the undocumented population, particularly because of its exclusion from the Affordable Care Act, and because of a number of policy efforts in California around that area. So there was an opportunity that came up. Oops. I just hit spacebar. Gotta love technology, right? Oh, so I don't hit spacebar, I should hit what?
Bottom left, click on the arrow.
There we go. So an opportunity came up with the UC Global Health Institute, which had some pilot funding for doing research in this area, and so the BLum Center and the UCLA Center for Health Policy Research jumped on the opportunity and put together this analysis. So what we're going to do today, sorry. There we go. I'm starting off by giving you a little bit of the background and discussion of the issues involved in the report. Maria-Elena will provide a summary of the data and the findings, which we think you'll find very interesting. And then Michael Rodriguez will wrap it all up and talk about the implications and conclusions from what we found. So let me start with the background and the issues that we're going to be covering today. So just in general background, undocumented immigrants are a large and important population. Throughout the report, we use the term undocumented. These are individuals living in the United States without the papers that they need to be here legally. Others talk about the unauthorized population. There's a variety of terms, but for consistency, we talk about undocumented. There are about 11.2 million undocumented immigrants in the United States currently. That's the best current estimate, which account for about 1/4 of all immigrants in the United States. So we think of ourselves as a nation of immigrants. And if you look at all the immigrants in the US, about 1 out of every 4 does not have authorization to be here. That's down from the peak in 2007, just before the Great Recession, when an estimated 12.2 million were residing in the United States. And this population is becoming more comprised of long-term residents. So when we're talking about the undocumented population, we're not talking about people who are here for a couple months to work and then go back to their country of origin, but are people who are settling here, raising families, and becoming part of our communities. So what we want to know is what are the conditions under which this group can be healthy? And in taking a social determinants of health perspective, we looked at 5 areas, and I will briefly review why those areas are important. So first of all, the first area that we looked at was healthcare. None of the 11+ million undocumented immigrants are eligible for Medicaid or insurance subsidies under the Affordable Care Act, and is becoming a larger proportion of the remaining uninsured as a result of that. So health insurance and a variety of issues around health insurance are important factors that promote the conditions under which they can be healthy. Most immigrants come to the United States to work, and they comprise a significant proportion of the labor force in different states. The undocumented population has been about 8% of the total U.S. labor force since 1997, and the majority of undocumented men, 95% in California, are in the labor force. So the undocumented population is comprised of people in families with a working adult, which is a higher rate of labor force participation than legal permanent residents, naturalized citizens, or U.S.-born citizens. So this group is the most involved in the labor force of any of those populations. As a result, work and employment policy is going to have a direct impact on the ability of these populations not only to make a living, but also to be in a safe working environment, to provide for their families, and other health and safety issues. So the second area that we're going to talk about is labor force policy. As I mentioned, undocumented immigrants are now largely in families. It's estimated that almost half of all undocumented immigrants live in a household with a spouse and children. In some cases, they are what we call mixed status families, so they are an undocumented parent with a child who's been born in the United States. Sometimes the children themselves are a mixture of US-born children who are automatically citizens by being born in the US with children who've been brought over without papers. And so there's an estimated 4 million families in the United States where there is a mixture of documented and undocumented persons within the family. Another 1 million children are estimated to be undocumented as well. So this highlights the importance of education policy. As you may know, in 1982, the U.S. Supreme Court case in Pyler versus Doe held that undocumented children have a constitutional right to primary, secondary school, K-12 education, but there is no such constitutional right to higher education for undocumented immigrants. And we all know that there's lots of research linking education to earnings, health behaviors, and the ability to remain healthy. So the third area that we're looking at is education policy. Fourth, whether people are going to work, whether they're driving their kids to school, whether they're going to church or doing other activities that create social ties. In most parts of the United States, you have to drive to get there. So the ability to have a driver's license is not only a function of having an ID that allows you to open a bank account, to get on an airplane, to travel, but also simply to legally be able to drive to work, to school, and to social events. So driver's licensing is a fourth area that we look at that has an impact on the ability of people to remain healthy. And last, there's been a lot of media attention to the deportations that have been occurring of undocumented immigrants in the country. They average about 400,000 per year, and there have been some surveys recently that indicate a majority of immigrants, not just undocumented immigrants, know somebody or have a family member or have some direct contact with somebody who's been arrested for deportation. So there's a high level of fear that reduces the mobility of immigrants in their community. The fear itself creates anxiety and stress that has direct impact on health. And so this is a fifth area, the engagement of communities with the program. Since changed its name, at the time that we did the review, it was called Secure Communities, and how that impacts the health context at a local level. So once again, there's 5 areas that we looked at policies that have an impact on the ability of immigrants, undocumented immigrants, to remain healthy: public health and welfare benefits, higher education benefits, labor and employment practices, driver's licensing and identification, and secure communities. We look at these areas at the state level. There is some county variation, which we'll discuss later as well. And these are policies where there's actually state implementation of laws and policies in this area. So to go into the details of what these policies were and to pull the sheet back and show you exactly where states rank, give you Maria-Elena Young.
Hello, everybody. So as Steve mentioned, we looked at 5 different policy areas, and across these 5 different policy areas, we actually identified a total of 11 different specific policies. So for each policy in each state, the state was given a score based on its level of inclusion of undocumented immigrants. And these scores were added up so that each state got an overall inclusion score. So what I'm going to do is, learn first how to use this. Okay, all right, I think we're doing that. So what I'm going to do is share with you our findings from this analysis. I'll give you a little bit of information about the overall inclusion scores of each of the states, but then really get more into detail about looking at the policy landscape in a sample of these states. So you can kind of get a sense of what these specific policies are and what it means for undocumented immigrants living in different states. So after calculating the overall inclusion score for each state, we determined that the national average inclusion score is negative 2.5. Now you might wonder, okay, how can a state get a negative inclusion score? And I think more importantly, what does that mean for inclusion of undocumented immigrants? So for each policy, a state could, if a state was inclusive in its policy, it scored a 1. If it was exclusive in its policy, it actually scored a -1. And then in a couple of situations, there was actually an option to have a neutral score, and so a state would get a 0. So to give you an example, driver's license policies. States that had a law that permits undocumented immigrants to get driver's licenses were given a score of 1. States that had a policy that either actively prohibited undocumented immigrants or kind of de facto didn't allow undocumented immigrants to get driver's licenses got a -1. And the idea there was that not being inclusive is actually a de facto act of being exclusive. So what this -2 tells us is that on the whole, our states are not very inclusive of undocumented immigrants, and indeed are actually quite exclusive. As you can see just from the coloring, most states did not even score above a 0. And this was a total range from -9 up to 10. But I want to go more into detail now and give you a sense of the landscape in each of these different states. So we'll start by looking at some of the states that scored in the top, kind of got the highest scores. And what we see in those states is that on the whole, they're relatively inclusive across all of the policy areas. And this will give you a chance to see what some of those specific policies are. I'll start by highlighting for you, I'll start by highlighting for you just the kind of where some of the states fell. So California did score the highest with a score of 9, the highest being 10. And the next set of states rounding out the top 5 were Illinois, Washington, Colorado, and Texas. And what we see when we look at this policy landscape in each of those states, California had relatively, very inclusive policy environment across all of these policies. And I'm just going to describe each of them a little bit to you right now so you have a sense moving forward of what we were looking at. So California provides health insurance for children and for pregnant women, regardless of their legal status. California also uses a calculation for eligibility for food stamps that includes undocumented ineligible family members in the family's income calculation. California offers in-state tuition to undocumented students and offers financial aid to those students. California limits the use of E-Verify. And E-Verify is a federal database that is used to determine work authorization. So people who don't have work authorization through E-Verify would essentially be blocked from employment. California offers driver's licenses to undocumented immigrants very recently. And also California has a law in place that helps to limit the Secure Communities federal enforcement program. So Secure Communities is actually now defunct, as Steve referenced. It's now referred to as the Priority Enforcement Program. But essentially this policy required that all local law enforcement agencies share information with federal immigration authorities about who they arrested. So it was really became a big part of the dragnet that resulted in a lot of deportations. So it gives you a sense here, California doing a lot in terms of its policies to ensure that not only undocumented immigrants have opportunities for health, but are also kind of protected and buffered from some federal policies that can be harmful to health. So we compare that with Illinois, very similar, the only difference being Illinois doesn't have a state level law that buffers secure communities, though at the local level, several communities and counties in Illinois have been working to do that, and so we could talk about that later. But interestingly, as soon as we get down to Washington, which ranked 3rd, we start to see still a relatively inclusive environment, but it's somewhat more mixed. So in Washington state, there's no limit to secure communities, and there's no limits to the use of E-Verify. And you can see too is that while they do offer in-state tuition to undocumented students, there's no financial aid. And I just before the seminar, I went and looked up what non-resident tuition is at University of Washington, and it's $33,000 a year. So even paying, so essentially it's still very unaffordable, even if you can pay. That's the cost, for everything, not just tuition, but kind of living as well. So then let's take a look at some of the states that were on the opposite end, the ones that had more exclusive scores. What we see is a pretty similar pattern in terms of these states having a high level of exclusivity across all of the different policies. So Ohio came in at the very end with a score of -7, but we don't want to single them out too much because, as you can see, a lot of other states also had very low scores. In particular, Alabama, Arizona, Indiana, and Mississippi and West Virginia all scored -6. And as I highlighted earlier, most states didn't even achieve 0 in the ranking from -9 to 10. So to give you a sense of what the policy environment looks like in Ohio, essentially everything that California has, Ohio does not have. Again, so no health insurance, a much more exclusionary income calculation for food stamps, no in-state tuition or financial aid, no limits to E-Verify, no driver's licenses, and no limits to secure communities. Nadi.
Can you explain if that's the total number of policies you're looking at?
Oh, thanks.
Because this is only 6
Yeah.
scores out there.
Repeat the question.
So the question was, is this the total number of policies? This is just a sample. Yes, thank you. There's a total of 11 policies that we looked at, and for just general space in the PowerPoint and also just kind of being able to comprehend everything, I just pulled out a few. Great question, thank you. And so you can see in Alabama a very similar trend. It's more inclusive in terms of their food stamp.
So we have an online question. The states that had high negative scores, what are their undocumented populations? I imagine they are much lower, e.g. Ohio.
That's a great question. Is that something we can address in the comments? Yeah. I mean, I think we can at some point go back and look at the map, and there's no clear trend really in terms of states with where their population is. So, for example, Florida has the third highest undocumented population, but scored a -3. So it's not something we tested empirically, but we're happy to address it more in the.
Could you restate the question just because people are asking?
Oh, okay. So the question, the question was whether or not there was essentially sort of a relationship between a state's undocumented population and its low inclusivity score. And so kind of the hypothesis being that states that have very few undocumented immigrants might be more exclusive.
I think it would be important not only to look at total population, but the map showing share of labor force. Percent share. And Nevada has a low population, but a high 10%, almost higher than California's share of the labor force.
Absolutely.
So I think it's got to be adjusted that way.
Yeah. So the comment from the audience was that also it's not just a matter of looking at the population of a state, but what proportion of undocumented immigrants, what proportion of the workforce is undocumented, or perhaps other factors as well. What proportion of children have an undocumented parent? So.
And just one last question, then I'm going to try and limit it until the end of the.
No, these are great questions.
What are the other 5 policies? Can you quickly just?
Yes, the other 5 policies are whether or not the state includes undocumented workers in their definition of employee in their workers' compensation laws. So essentially this is if in workers' compensation laws, if undocumented workers are explicitly named as potential beneficiaries, it adds the extra level of protection in case they have injuries on the job. The other two were in driver's licenses. We looked specifically at whether or not a state opposed the Real ID Act, which is a federal piece of legislation that imposes restrictions on what types of identification can be given out and has a huge impact for being able to give driver's license to undocumented immigrants. And then the use of E-Verify was actually, that kind of collapses two specific policies. So it's 2 policies are actually covered in that line right there. Any other questions? Okay. So to move on, I presented sort of the extremes at some level, the states that scored the highest and states that scored the lowest. But what we really see in the middle is actually very much a mix. And not just that, but different levels of inclusion across the 5 policy areas. So what I want to share with you right now is a chart that we put together looking at the number of states that scored the highest possible or the lowest possible, and also the middle inclusion scores. So across the bottom you'll see as each of the 5 policy areas, and the bar in light blue represents the number of states that got the highest possible score in that policy area. The gray bar is the number of states that got the lowest possible score, meaning the most exclusive score in that policy area. And then the middle purple bar is kind of gives you a sense of who fell into the middle. And so what we see here first is sort of emphasizing what I mentioned earlier. Across the board, there's a very low level of inclusion. So in the area of public benefits, only 6 states received the highest possible score. When it comes to driver's license and secure communities, only 3 states scored the highest possible score. But I think what's interesting here and important to point out is that the areas that kind of had the highest level, there was differences in terms of which area had different higher levels of exclusivity as opposed to inclusivity. So what you can see here is that the majority of states actually had very exclusive policies when it came to higher education and the Secure Communities program. So what this tells us is it's a reminder first that when we're thinking about the health and well-being of undocumented immigrants and trying to think about it from a policy perspective, it's really important to see sort of the whole scope of different policies. If we were just looking at public health and benefits, we might draw certain conclusions. If we were just looking at secure communities, we might be drawing other conclusions. But I think the other important point is that sort of being inclusive in one area doesn't necessarily translate into a state being inclusive in another area. And I think 2 states highlight that really well for us. So if you look at New York scored the highest, most inclusive possible score in the area of public health and welfare benefits. So they offer health insurance for children and pregnant women, regardless of their legal status, and they use the more inclusive calculation for food stamps. As public health people, we really like that. That's good. But if you look at their other policy areas, they're actually quite exclusive. So they don't offer financial aid to students, even though they give them in-state tuition. Massachusetts had a very similar trend. So kind of thinking about promoting the health and well-being of undocumented immigrants, all of these policies are really important, kind of as a whole, make up very unique policy environments across each state. So I'm going to hand it over to Michael right now, who will sort of wrap it all up for us and give us a sense of what this all means.
Thank you, Maria-Elena. It's a pleasure to be here, and now my turn to learn how to do this.
The keyboard's easy.
Okay. So this study showed that there's great variation in the way that states implement policies that help to promote the health of undocumented immigrants and their families. And it also shows that all states have lots of work to do. As is phrased in the title of one album, there's room for improvement. While California is certainly doing the best, is scoring the best, we know that there's more work that California needs to do in a number of different areas, whether they be regional variation within the state's borders, as well as local implementation of what's going on. Some of the areas that have been mentioned and that policymakers are working on include expanding health care for all undocumented individuals, as well as paying attention to the local variation that we do see and the way that policies are implemented, as well as the local additional work that can happen. The other thing that's important to point out is that it's one thing to have a policy in place. It's another thing to implement it and how it's implemented. And that's particularly important with all policies. For example, for Medicaid, undocumented immigrants are eligible for emergency Medicaid. But the way that states define what is emergency Medicaid can vary. So, for example, in one state, they may say, it's an emergency when you need dialysis and your kidneys don't work because you're going to die. And so they will provide dialysis as an outpatient service. Other states don't provide that, and they only provide dialysis when you are actually dying and at an emergency room. And that's the only thing that will help you to live. So you can see that the way that states implement or define a certain characteristics can have a great impact on the way that that plays out in the lives of undocumented immigrants and their families. The way that states also address some rights that were mentioned earlier, Dr. Wallace mentioned the Supreme Court case that made education, primary education, accessible to all people, to all children. Didn't matter what their documentation status is. However, some states still have made efforts to try to create some challenges or barriers for parents and their children to access it by requiring or trying to require their parents to have certain documentation that would be difficult to produce if you're undocumented. And so those kind of barriers and those kind of additional policies put in place make it much more difficult and help to sort of understand how this issue of implementation plays it out. The other issue that's important to appreciate is the local variation. So not all localities have participated in all aspects of these federal or state policies. For example, in the Secure Communities policy, some communities have actively told their local enforcement that they were not going to cooperate because of their concerns that cooperation is something that would not be productive. It would make immigrants, undocumented immigrants, and potentially their children be less likely to go for services, potentially provide situations that could provide more harm than good. And so that's how local policies, an example of how that can play out and provide additional safety or not so much safety with regards to the way that implementation matters. So we went forward, we looked at what was happening, we came up with some recommendations. One is to expand laws that actively grant rights. The federal government has a basic level of services that it provides, and states have stepped in to try to address the needs that they still see their populations require in order to promote the health of the undocumented immigrants as well as their children and the communities in which they live. And so some examples of going beyond the federal standard that have been mentioned today are to provide opportunities for a driver's license and for having that identification, that freedom that comes with that, and the additional opportunities. To provide opportunities for higher education so that it goes beyond just having elementary school, but also being able to provide greater access to higher education. And of course, issues of access to health care, so it's not just limited to a few people, but it's actually available to all. To buffer, Maria-Elena talked about buffering and how some of these laws actually help to minimize the potential harm that could happen of restrictive federal laws. That's extremely important. Some of the examples that we mentioned and we looked at have to do with the way in which E-Verify gets expanded to other areas or limited to the areas that the federal government requires. Other ones have to do with what we had previously called the Secure Communities Initiatives, now called Priority Enforcement Program, in terms of looking at the degree to which localities will participate or cooperate in ways that might potentially cause harm to those communities. To include undocumented immigrants in policies, in the general policies that happen. So, for example, one of the mainstay policies that we have in the United States to provide low-income families with support is the SNAP, or the food stamp program. It's referred to in general. And what we need to do is make sure that these programs that are there, meant to be a safety net, are available to all and not to just a few. So that it's not just something that is accessible to a subset of low-income, needy populations, but it's actually available to all. Another example that Maria-Elena mentioned is the workers' compensation. Again, making sure that workers are safe and they have the safeguards to help them to work in environments in which they can continue to work and be productive. Extend work that we've talked about to other policy areas. So what this is about is really about thinking about how is it that we as a government, as a community, care for the residents who live here. And what are the basic rights that we feel that all individuals should have? These basic rights are ones that are spelled out in the Universal Declaration of Human Rights. It's an international treaty signed by the United States and really addresses a number of political, economic, and social rights, basic rights that all people in the world should have in order to be able to promote their opportunity to be productive and to promote their health and the health of their families and their children, and to also help promote the overall development of countries, no matter whether they're developing or developed. With regards to some of the areas of expansion, some examples have to do with the area of health, for example, providing more services, particularly as the population ages, the issues of end of life become even much more important for us to be aware of, and the services and resources for that should be available to all. Similar for workers, issues of safety are not all the issues that workers, particularly those workers who may be more vulnerable, may be more low income, may work in sectors of industry in which there's less oversight, they suffer from many other potential harms, such as wage theft. And so we really want to make sure that people have safeguards so they can work and they can be able to use all the wages in which they have earned to be able to support their families, their children. The other issue is this concept of integration. Ultimately, it's about minimizing the groups, in this case the undocumented, that are marginalized, that are not part of society, that as a group, because of the concerns of becoming identified, potentially deported, they become isolated, and in that situation, they're not contributing as much. They don't receive all the resources that they potentially are eligible for, as well as they don't have the opportunity to be able to contribute more to society. And in addition to that, the impact is also hits their children. Most of the children of undocumented adults are legal citizens, eligible for all the types of services that we've talked about today. And yet, because of the fears of becoming identified, many times they do not use those resources for which they are legally eligible to receive and which they would benefit. That is something that not only harms those children, but also can harm the families and the communities in which they grow up. Because potentially, instead of moving in areas and in directions that are positive, help them to grow and develop, they may grow in other areas that may not be positive. And that's what we ultimately want to do, is promote integration of all. All this is moving towards a climate of acceptance. What we want to do is move so that everybody is not only included, but accepted and valued. Ultimately, reinforced by the policies that we pass, so that those policies are ones that we know not only contribute to our development, but as the Robert Wood Johnson Foundation would like to say, contribute to a culture of health. So, next steps, the variety of different next steps. This study that we did only covered a limited number of policies. We focused on, as Maria-Elena talked about, the policies that particularly are linked to health, using a social determinants of health perspective, one that acknowledges that what happens with regards to where you're born, where you grow up, where you go to school, where you live, where you work. Those factors that influence those environments have the greatest impact on our health. But, as was talked about earlier, there's also other policies that are important, exclusionary policies that are going on, many different elements and work that needs to happen, as well as research that needs to happen to understand what does it take to have a more inclusive community. What are the policies that have the greatest impact, and how do we do that? In addition to research, we need advocacy. We need to be able to take the research and the information that we learn and translate that to action. We do that by partnering with others, partnering with community members, partnering with the public sector, partnering with advocates. In that way, we help to promote this translation of research into action so that we can help to improve the environment in which we are all live, so that all of us can have greater promotion of our health. Thank you. So we'll take any questions or comments that you have. I don't know if Maria-Elena, you want to get up and join me, or how we'll do this. Yes.
First of all, congratulations on a great report and a nice presentation. The laws that were introduced before the California legislature, what specifically do they address, and are they, if they were to pass, would they help fill in the gaps you're talking about?
Could you restate the question?
Yes. The question was...
Also restate the compliment.
There was a comment about the positive presentation that was given by all the panelists, as well as a question related to current California legislation. That current California legislation, there's several different policies that people are looking at right now that actually, and will those policies help to address the gap? And the answer is yes. For example, currently there's a bill by Senator Lara that is being considered to move forward that would help to expand access to health care for all. So there is lots of work. In fact, recently the California legislature put together a whole packet of 10 policies that were intended to address some of the needs of undocumented populations in the state of California. So to not only sort of build on where we're going, but actually take us to the next level and provide opportunities to demonstrate to other states what they can do to promote the health of their populations. Thank you. Yes?
How does California differ by counties? I only bring that up because there was a recent story in the LA Times about a sheriff in Kern County who highlights, right, that he identifies with the sheriff in Arizona. And so how does California do by counties? Did you guys look at that at all?
That's an excellent question. The question is, how does California do by county? And the answer is it in the same way that the states in the United States vary, our impression is that the counties also vary. As you have mentioned, this example of a central county police police officer who was identifying with some of the more conservative elements in other states. And so what we know is place matters. And that the local politics can significantly influence the ways in which these policies play out. So we didn't focus on that particular issue, but it's important because it does emphasize the reality that the actual situation in which people live is shaped dramatically by the local context. And so just the same way that we talk about how what state you live in it actually influences also the rights and resources that you may be eligible to receive, what county you live in California at least, and I would assume this would extend to other states, also have a significant impact with regards to those resources. And California does have wide heterogeneity. So that's important because it helps to also emphasize that California had a bit long ways to move. It's one thing to pass more policies on a statewide basis, but we need to make sure that all the counties also provide a baseline of services for all. Yes. And Maria-Elena has a few more comments about that.
Yeah, I mean, because I think that's a great question, and it potentially brings into doubt kind of the importance of state policy if there's county level variation that's, either kind of jeopardizing what's happening at the state or just not being implemented fully. And so as Michael indicated, that's still an issue even in California, which scored the best. But I think what's another thing to think about in terms of county variation is what happens at the state is kind of these inclusive policies that pass at the state are generally the result of initial efforts at the local level. So in California, we have a law, the Trust Act, which helps buffer against secure communities, which of course doesn't exist anymore. So we'll see what happens with that. But that really began because local level sheriff's departments started by saying, you know what, we're not going to participate in secure communities. We're going to actually opt out. The Obama administration said you can't do that. So then the state kind of stepped in and said, okay, wait, we need to figure out kind of a more uniform way to deal with this. So the variation, I think, can present a lot of problems in terms of making sure that there's a uniform kind of promotion of the well-being of undocumented immigrants, but it's also kind of like the seed for action and advocacy to advance more inclusive policies.
Yeah, no, that's an excellent point. And
I don't know. I'm just looking at the
don't
camera
just stay
thing.
here. Yeah, let's do this together. On a related note, just as Maria-Elena pointed out, that it is about what happens locally that influences eventually what happens on a statewide basis, because sometimes a statewide basis just doesn't have the support needed in order to make it happen. So you have this happening in different places, and finally there's enough of a groundswell to actually make that happen on a state basis. Well, the same thing happens federally. So what we are just demonstrating is that there's this movement going on. As soon as there's a critical mass on a federal, on a statewide level for certain policies, then that will provide more support for federal policy to change, which is the process. Yes?
So you referred to, how local policies can contribute to building support for being and creating more inclusive policies. But I'm wondering if you have any other thoughts about ways to build support, particularly among people who might initially be opposed to having more inclusive policies be passed and implemented.
Do you want to repeat that question?
Yeah, so the question, which is really the kind of the heart of a lot of these policy questions, is how do you start to build support at the local level for inclusive policies? And I think that's a really hard question. Thinking of it's a critical question. I mean, I think coming as health people, what we have is this really awesome opportunity to emphasize how what's happening, whether it's positive or negative, how it has an impact on health. And as a state, as a society, really the health and well-being of our community is critical. So the health and well-being of workers. If you want to look at it as a purely economic issue, we got to have healthy workers, And I think that's sort of like a starting point. But if you want to think about it in terms of future citizens, you need to have families that are healthy. So coming just from that health perspective, I think offers an opportunity to be sort of non-political in the way that some of these issues have been politicized. So I think that's an important start. I don't think that's enough, but it's at least kind of an opening. I don't know if you have other thoughts about kind of how to garner support.
Sure. Just like Maria-Elena said, I think that the issues are multiple. There's multiple reasons why one could talk to people who I think most people who may not be in support initially, most of them are well-meaning people. Most of them, but I believe that most of them probably have a limited amount of information that they get. So what I would say is that let's look at all the information that may be involved with providing more inclusivity or not. And that from a public health perspective, one has many reasons why more inclusivity can translate into narrowing the gap between the most wealthy and the least wealthy with regards to the resources and their ability to contribute, to be healthy, to go to school, to go to higher education, and to be able to not only do what they can potentially do, but also be able to be a positive influence in their community. And so, as I've told some of the reporters that I spoke with, the same thing. I said, well, from public health, we look at it as if you don't put the investment up front, and you say that let's not do it, it's not worth it, then that is frequently what we say is penny wise but pound foolish. And so I think it really is about investing in our future so that we can have a healthier and more productive society for all.
Okay, I've got an online question. How is health insurance for undocumented children defined by this report?
That's a good question. Should I want me to?
Go ahead, repeat the question, please.
Yeah. So health insurance the question is, how is health insurance for undocumented children defined in the report? And it's a great question because, as we know, public benefits provide different levels of care in terms of what's included in a health insurance package. And we essentially use the definition of full scope Medicaid. So what that means is it's not just emergency care, it's preventative care, it's well child visits. All of those services would be covered under health insurance. And so for various states, for California, it's like Medi-Cal essentially for undocumented children. Do you think that answers the question? Is that okay? Great. We'll find out.
Any other questions or comments? Yes.
Red states tend to favor some policies more than others, and blue states likewise. What did you see a pattern?
Well, if you recall the states that, so the question is, do red states and blue states, or does party affiliation, is that associated with, with some of the issues, with some of the policies that we talked about, or the degree of inclusivity or not? And so, what you see, and so one would have to remember where more of the red states are and where more of the blue states are. But you could see that in some ways there is an association, in some ways there's not. I think that what we've learned, and it's an interesting question, is that what is it that's related to this issue? So some people popularly think that it's about the number of undocumented you have. So if you have more undocumented, you're likely to have more immigrants. You have more immigrants, you have relatives of immigrants, and then you have more of a group of people who have a vested interest in this population, and perhaps there may be some support from their policymakers to create a more welcoming environment. As it turns out, there's some debate as to whether that is actually true or not. In fact, there's some literature that suggests that it's not true. That in fact, it really is motivated frequently by politics, and by politicians, and by some people who take the opportunity to actually take advantage of moments and economic situations and a density of particular political inclination to be able to then push certain policies that might be more exclusivist than not.
But let me refine that my question. Did you notice, was there any pattern in the red states that did have some inclusive policies, of those policies being a certain kind of policy?
I'm hesitant to say that there. Oh, sorry. To clarify the question from Gwen, of the more conservative states, or ones that we would perceive to be more conservative, were there, when they had inclusive policies, was there a trend in that they were more inclusive in certain areas, like public benefits or education? And I'm hesitant to say that there isn't any sort of clear trend. I mean, we didn't test it statistically, but for example, Texas and Florida both offer in-state tuition. but Alabama and Georgia don't. So what does that really tell us? I don't know. So I think that I kind of the point that I made earlier with looking at sort of where the levels of inclusivity and exclusivity fell across policy areas sort of indicates that there's kind of complex trends going on in terms of the policy landscape in each state.
I'd have to say, as a journalist, that's a perfect question. As a researcher, I'd have to say, that requires more research.
Right, yes, exactly. Exactly.
Any other comments or questions? Yes.
Do you want to talk about, wasn't included in the report, but how states are responding to DACA? In terms of, is that giving them cover or an excuse to be more inclusive? Or
Do you want to step up and?
No, go ahead.
Do you want me to talk about that? Sure. So Steve brought up something that's actually come up with some of the media interviews, and I think a broader issue, which is that a lot of young people have received deferred action for childhood arrivals, which grants something of a lawful status, but minus essentially all of the rights and privileges that you would get if you had a green card or if you were a citizen. And so the question is, a lot of states are starting to move towards passing legislation to include DACA youth or DACamented youth. So for example, Ohio just recently extended in-state tuition to DACA youth. There's been a battle in Arizona. They've tried to take away driver's license from DACA youth, and that's been struck down in the courts. And so there's kind of this new battlefield, I guess you could say, in terms of policies specifically for those who've received deferred action. And with hopefully the deferred action for parental accountability program that will move forward will also include a lot of adults and parents who can get deferred action. So I mean, I think this adds sort of a new layer to understanding of the well-being of an undocumented population, because this is a group of people who are no longer undocumented, but they certainly aren't documented in the sense of kind of the traditional sense of that word. And so I think we might start to see a lot of states doing things that are inclusive for those who have deferred action, but continue to exclude those who will continue to be undocumented. So it's something to sort of keep an eye on as we create essentially new legal statuses across the population.
Right. It also brings up the issue about the connection that frequently is made between immigration status and receipt of services. Mm-hmm. Frequently, there's this dichotomy that's put forward that, well, what we need to do is we need to fix immigration, because if we fix our immigration system, then we'll be able to provide these services. And I would say that that's a false dichotomy, because we shouldn't link the two. If we're going to provide services for people who live in the United States, we should that help them to live a basic life that has access to basic health care and services, then we should provide those to all people who are within our borders. And it shouldn't depend on whether they have a particular immigration status or not. Immigration status can then result in a subsequent other sort of access or rights that one can have. But with regards to having policies that promote wellness for individuals, that wellness is not only that goes from those individuals, but also to their children and to the communities in which we all live, and helps all of us with having better development and having better health and opportunities.
I have another online question, and then I think we're going to have to come to a conclusion. Where are we in terms of DACA? Also, where's the immigration reform bill?
We're public health.
Answer that question.
So the question is, and I'm just going to read it so you can see it here. Where are we in terms of DAPA, which is the deferred action for, it's called deferred action for parental accountability. It's a deferred action for parents of citizen children. And where are we in the immigration reform bill? We're public health researchers. There currently there's no immigration. I mean, the immigration reform bill that was passed in the Senate in 2013 is dead. The deferred action program that President Obama announced November 20th of last year is being held up in the courts. So nobody's benefiting from that program right now, which means that people are actually actively being harmed while they wait for that to go through the courts. But in terms of the nitty-gritty politics, I'll leave that to somebody else.
Well, I think we need to wrap up in fairness to everyone here. So thank you very much, and thank you to our speakers.
Thank you.